Good afternoon and welcome to the Iowa State University Dairy webinar series. We're excited to have this topic today. A couple of items here. We will have these archives on the I-29 University website. It takes us about a week to get them archived. Probably tomorrow you will get an email from me reminding you where that is and asking you to take part in the survey that we do to try to make these programs better as we go down the road. Today's speaker is Dr. Luciano Caixeta. He's going to discuss data from a field trial he's working on energetic boluses at dry off. Luciano comes to us as an assistant professor of dairy production medicine at the College of Veterinary Medicine at the University of Minnesota. Doc, as I always say, the podium is yours. Go ahead and share your screen and we'll start the program.
Good. Thanks for the introduction, Fred. Do you see my screen there?
Yep.
Okay, perfect. Good. Just making sure things are working as it was working 5 minutes ago, but you never know. But thanks for the invitation. We'll spend the next 45 minutes to 15 minutes talking about some of the dry off projects and studies we have been doing. And I like to phrase this or title this presentation as dry off can be more than just dry cow therapy, because for many years, when we think about the dry cows and the dry off, we only think about dry cow therapy. And now that we're starting to study a little bit more and understand better how dry cows what we do to dry cows can affect the lactating that cow. When she starts lactating, we start putting more efforts into understanding how we can manage them better as they're drying off and during the dry period. So it's good to see the last few years more effort being put into that, because it's a topic that was for many years somewhat forgotten, and it is good that we are looking to that and being more efficient as a whole. As was discussed a little bit before, I have this presentation having two parts. So the first part, I'll talk a little bit and have some of the background of those challenges of the dry period. That way you can understand what's the rationale for the studies we're doing, the field trials we're implementing right now. And then the second part is actually the presentation of the data of this randomized controlled trial with this alternative management of dry cows prior to dry off that we did in partnership with a company. Just to start with, I always like, and just a background as what I do. I'm working with this acidogenic bolus alternative because I have been working with transition cows for basically my entire career. So since I started my post-DVM, during vet school and post-DVM training, I have been working with dairy cows. And one of the things that's in practice and working at farms is there was a lot of diseases that happened that most of them could be prevented. And I got tired of treating. We're pretty good about treating those and we know how to do it, but you just get tired of doing that. So when I started moving towards my PhD and more formal training after a DVM training, I decided to work on that to prevent those. And then the transition period was something that was a natural place for me to investigate. So studying this, like I said, it's when most of the diseases are happening. So about 2/3 of the diseases will happen during this period. Half of the cows will be leaving the herd within the first 60 days. Like on all your turnover, half of it will probably happen within the first 60 days. So this is a period very important to the whole system. So the goals we have, and when I'm thinking about the transition period, you can see in this graph here is a little bit different from that traditional 3 weeks before calving to 3 weeks after calving. And the reason I look into transition period as all the way from dry off, and then here you can put 45, will depend on your farm, right? But that's from the moment we dry cow off to the moment they leave the fresh pen, which that has some variation here too. And sometimes I even extend this all the way to the moment when they finish voluntary waiting period. That's what I work with, because in the way I see it, once we have the cows ready, healthy, and ready to be bred, that's a success. We can have that cow be very productive going forward. And once we dry them off appropriately, she will likely go through the dry period very well. So our goals during this whole period is to support those cows so they can have adequate and rapid responses to all the challenges that they are facing this period. And we have different changes in diet, with different changes in management in general, pen changes. So those are things that we have to always be very cognizant about it. And then by giving them and supporting them to have this adequate response, we're going to have a successful transition. And as a consequence, they'll produce more and they'll be reproductive successful. So before going any further, one thing that I always like to show, it is this quote that I borrow from Dr. Gordy Jones, that in which he states that milk production is the abscess of stress on the life of a dairy cow. And that's 100% true. So when I think about a cow, sometimes I like to think a cow as like she has a limited amount or limited capacity to produce milk. So if you think about it as if she was a bottle of milk, for example, if she started using a lot of that energy to go and respond to some stressors, she'll have less energy to milk production. So if we can minimize this stress, and hopefully if we can have all the stress gone, this cow will produce more milk because she's going to be using most or all her energy that is available to produce milk. So thinking about it, it's very important when I visit any farm for consulting and when I actually implement or design any studies, because I would like and I want always to develop management strategies that will decrease the stress in the life of this dairy cow. So with that in mind, the dry period, like I said, for many years was kind of forgotten, and we have cows in the back 40 or cows in the dry pens, and we're just feeding them a low energy diet, something that we didn't think much about, and they'll just survive that period, hopefully not gain a lot of weight, and they'll calve again, and then we start worrying about those cows again. But there are many different challenges that we can have in this phase of the lactation cycle. There is some examples, and I'll start here with heat stress, which right now, as we're talking about, snowstorm and being fairly cold, that's something that we don't think about. But even here up in the upper Midwest, we do have to deal with heat stress in the summer months. And we have a lot of projects, especially in Florida, where that's present more frequently. You see a lot of the data coming out of that showing that cows with heat stress and heat stress around the dry period can actually affect not only that cow in her next lactation, but her daughter and her granddaughter as adult animals. So that's something that is very important. And as an industry, we have been much better on fighting that challenge and getting rid of those stressors. I'll move this side here. Another important is social and metabolic stress. That's another stress we deal with. So too many change in pen movements or too many changes in diets that are very different are all things that can be very stressful for the cow as they change the rumen flora. It changes how the cow is mobilizing and utilizing that energy, that's resources that she has, as well as like adequate or inadequate stocking density if you have too many cows in a pen. So that's like you have seen and you've probably been exposed to studies showing that adequate stocking density, so lower stocking densities like 100 to 80% to 100, depends on the breed and the type of the pen, are adequate stocking densities for cows during that the dry period and the fresh group, to avoid those cows having more issues once they calve. Similarly, I mentioned previously here about nutrition and what we look for. A stressor that we could generate in those cows is if we don't manage well their nutrition or how long they're dried off for, we can have cows starting to gain a lot of weight, a lot of body condition score during the dry period, which then will affect them on how they start mobilizing too much fat and excessive amounts of body reserves around calving. And then you have all those metabolic diseases that we often diagnose on cows, and they are linked to decreased milk production, decreased reproduction performance. So all those bad downstream outcomes based on managements that we could have done a better better management while the dry period. So all of those are in itself a full-on a webinar for an hour or so, but today I would like to think about more the dry off. Like I said, I'll be at the very beginning of that timeline I gave at the moment of dry off, or at the first few days, maybe first few weeks around the dry off, before and after. And those are, at that point, cows are very low maintenance, let's put it quote unquote, because those animals they do not demand as much attention as other cows in different stages of the lactation cycle. So two things that I'll talk a little bit and I'll expand a little more is dry cow therapy, which also, as any of these different challenges here, could be its own hour-long or day-long conversation. But I'll just hint at it a little bit of the main take-home messages, and we'll talk a little bit more about dry off, because that's basically the rationale behind why we are doing this clinical trial that we performed 2 summers ago. So in going forward, selective dry cow therapy, it has been popularized and being investigated much more in the last few years, because it lead us and help us decrease the use of antimicrobials in animal agriculture. It definitely decreased the number of antimicrobials, the amount of antimicrobial that we use compared to the blanket dry cow therapy. And the good news is we can do that without affecting other health. So in very easy terms to understand, if we've at dry off, let's say this is a group of cows or a group of quarters, depends on how we are doing this dry off, that we have for a dry off at a given week or a given day. And we have within that, we have a group of cows or some quarters that have intramammary infection or have high somatic cell count. And those are animals and quarters that definitely benefit and should be treated at dry off. But usually we have the majority of the cows and quarters are not infected, or they do not have high somatic cell count. So in theory, those quarters and cows do not need to receive any treatment. However, what has been the recommendation, the National Mastitis Council, NMC recommendation for the last many decades is to treat all dry cows with antimicrobials, and lately, couple decades, fewer decades than this case, with internal teat sealant or any teat sealant. And the reason for that is because when this recommendation was developed is the amount or the type of bacteria, the type of infections we had with a lot of contagious pathogens, and the amount of cows that were infected at dry off was very high. So it was much better to just treat all the cows and get a hold of that issue. And that has been very effective to the point that the reason that we have this situation here now, which the majority of the quarters and cows are not needing treatment, is because we did blanket dry cow therapy and really control those pathogens in the farms for many years. So this was definitely a very effective way to get us to where we are now in the udder health scenario that we have now. So because we have that, the luxury that we kind of brought upon ourselves is that now we can actually just go and select cows that at cows or quarters that actually need treatment and only treat those. And by doing that, what happens is now we can actually decrease the amount of antimicrobials that we use. And the ways to define which cows or quarters that we'll be treating, it will depend what type of methodology you want to use. You can use cows, you can use rapid culture. So you collect milk, different quarters, put them on a plate and see what grows and what not. You can use algorithms based on DHI data, somatic cell count data, plus clinical mastitis data on the farm. So each of this has its advantages, has its requirements at a farm to be successful, which that discussion in itself, it's beyond what we're going to discuss today. But those are things that can be you should think about when you're trying to implement those. So the good news is, like I said, in a farm that is adequate for the use of this, that do not have for example, if the bulk tank somatic cell count or average is greater than 250,000, you have to be careful when implementing those strategies, because you might have too many infectious pathogens or too high somatic cell count animals, and then you have to be careful. But if you have a herd that is adequate for the use of selective dry cow therapy, you can reduce the use of antimicrobial by 21 or 58% of what you use, of the tubes you use, depends on the strategy you have. And that doesn't lead to any negative impact on cows' health and performance. So that's something that's should be talked, and like I'll say, definitely consult with your consultants or your veterinarians and see if we could implement that. That's something that's worth talking. And I know that last year, many people had to actually do some sort of selective dry cow therapy because we didn't have tubes for drying off cows. So was a forced selective dry cow therapy, but we can do a select discretionary, and we actually decide to do the selective dry cow therapy. So with that, I just want to show that there's something that we're doing now to decrease antimicrobials, which is actually economically relevant, because the cost of dry off tubes can be very high. So treating fewer cows is actually something that's economically viable, as long as you don't have a bigger problem by not treating those animals. Then another challenge that we have seen, and this is something that wasn't present when those recommendations were, is that we have a lot of cows still producing a lot of milk by the time they dry off. And I just mentioned that there was a recommendation because if you look at this first bullet point here, the National Mastitis Council recommended many years ago that the milk production for a cow to be dried off should be below 33 pounds per day. And the reason they recommended that is because there was some association studies done showing that the cows that were producing more than 33 pounds per day, they were more likely to have intramammary infections, have clinical mastitis, and other issues postpartum. And one of the reasons for this was that this increased milk production at dry off, it elevated or increased the risk of environmental intramammary infection. And most of that happened because cows, they're producing more milk, were more likely to leak, have some milk leakage after dry off. And that happened mostly because there was a delay in this formation of the teat keratin plug. And then this teat keratin plug, teat canal keratin plug, it's pretty much a internal or a teat sealant, but it's a natural one that cows would produce once they are dried off. The problem is, and both panels here kind of show the same, so I'll work here on the right side since it is a little less busy, but what happens is cows that produce too much milk here, in this case 21 kilos, about 44 pounds, the dashed line, they are less likely, or they have a lower percentage of them that has this keratin plug naturally forming after dry off. And that's happened just because of this other engorgement and high pressure, milk leakage, and then they start forming this keratin plug, and then the milk leakage will push it off. So that's something that it was discovered, and that's one of the reasons that the use of internal teat sealants or teat sealants in general has been very effective on helping the decrease of these environmental intramammary infections or these new intramammary infections happening during the dry period. So that is nowadays an even greater risk if you were to not use internal teat sealant or teat sealant, because the cows are producing more, definitely more than 33 pounds. Just as an example, I pulled data from 4 farms here in Minnesota that I work with, and I collected the average milk production for those cows in the last week before dry off. So we got data from the last 7 days of lactation, average it out to get rid of the noise, and then we plot this as just a demographic plot here, just to have this histogram to show how much it is. Then what we can see here on the y-axis here is actually the count, or how many cows in this 2200 data set had the milk production. And on the y-axis here on horizontal line, you have the actual milk productions that dry off on that average. And then if you remember, I just said the recommendation was 33 pounds. So if I cut here at 33 pounds, about 93% of the dairy cows nowadays are producing more than that. So that recommendation should definitely, it definitely needs to be updated. And we cannot really use that as a recommendation because we have basically all the cows in the farm, it's producing more than that. So high milk production at dry off is something that's very important to the dairy industry nowadays. And the reason it is important is because the cows that have high milk production, like I said, they'll have greater udder pressure post dry off because we're not letting that milk out, which means that they are more comfortable when they lie down, which then they might not be lying down as often, leading to all these welfare issues. And also higher milk production will likely have more milk leakage and more chances of having infection. So high production at dry off is a problem for the dry off itself. It's not a problem in the whole picture, because if they're producing too much milk, it's for 2 reasons. One is we have better cows and they're producing more. And we also were very efficient on getting them pregnant, and that's why they're producing too much milk at dry off. So just an example, the medium, which is the volume that was most produced in all this this distribution here was 62 pounds. So that's where the cows are usually in the US, here in Minnesota, producing at dry off. So I just hopefully I made the case, say producing too much is a problem. So what we can do to decrease milk production at dry off. So a couple of strategies. One is to decrease milking frequency, and that will decrease the milk production, and numbers are showing 20%. But what does that mean is if you are milking your cows 3 times a day, you start milking them twice a day. If you're milking them twice a day, those cows in the last 1 or 2 weeks prior to that dry off, you milk them once a day. And that has been effective in decreasing milk production of those animals. Another option will be to decrease the quantity or the quality of feed. So you can either do not offer them, have the same diet, but do not offer them as much as they would be eating up to those 2 weeks before calving, before dry off. Or you can actually decrease change the diet a little bit and have something more like the dry cow diet with less energy, more fiber. And that is also effective on decreasing the milk production of those animals before dry off. The two things about these two strategies are that to get this accomplished, you increase management input. So you either have to have a different pan for those cows go in, have a different batch of food that you're mixing. So it depends on how many cows you have. In some places, it's not feasible to have a whole different diet for a group of cows because you don't have enough animals. So those demand some management changes that are beyond just implementing it. You just have to have more space, sometimes more labor. So those are things that often are not done just because it's not feasible at a given situation. The other way that have been described and used to decrease milk production is to actually use some prolactin, which is the stimulation of milk production, and use some inhibitors. So we go there and give them a shot of one of these inhibitors, and then they'll decrease milk production. That's one way of doing it. There's nothing labeled for that in the US. So, but in research and theoretically, this does work. And there was some trials done in Europe a few years back, but the products were never available here in the US. In another strategy that was also described first in Europe, and that's what we tried here in the US, is the use of acidogenic boluses at dry off, and that also decreases milk production. And I'll show you going forward how does this acidogenic bolus will lead to that decrease in milk production. So the acidogenic bolus we used in our trial is commercially available, and you probably had some of the BI representatives have talked to you about it, and it's called Bovacalc Dry. And Bovacalc Dry, it is quite similar to the actual Bovacalc that you would give postpartum, as it has calcium chloride and calcium sulfate, and those values are pretty close to what a regular Bovacalc pill has, but it also has ammonium chloride, which is the acidogenic part of it, and that's what is the most effective on causing cows to have this compensated acidosis and lead to the effects we want. And the one big difference that we have, that this product here have compared to the regular Bovacalc that you give to cows postpartum, is that the treatment actually takes 2 bolus instead of 1. So the way this works is, as I said, this is an acidogenic bolus. So it causes a temporary and mild decrease in blood pH, which decreases cows to have a temporary decrease in dry matter intake. And the other route that it leads to this response is by decreasing lactose synthesis. So decreases the uptake of glucose by the mammary gland. So both of these pathways together lead to this decreased milk production. And why is that important? Based on what we just presented before, is by decreasing milk production, we're going to have lower udder pressure, lower milk, decreased milk leakage, and as a consequence, decreased pain and or discomfort, and improved cow comfort post dry off. So that's the rationale, and that's why we use this strategy to try to decrease milk production. And the reason it is somewhat easier to implement, in my opinion, is because we don't have to, besides having personnel to give the bolus, we don't have to make any changes to pens or to diets for those cows. So, like I said, the product was first described in Europe and was actually studied there. So there's a group in Spain which did some trials, and I'll show you what they found that leads to the designs we have here. So in Spain, they did a series of studies to understand how the bolus work. First of all, the first study they did was they give two cows to figure out if we kill cows or not, and it didn't. That way they went to a few other projects. And the second experiment they did, they give it those bolus, the same one, to hosting cows, late lactation cows. And the reason they did to late lactation cows and not dry cows is because they wanted to check what was the effect on milk yield, right? So what they looked into was urine milk pH, which is the parameter that we use to determine if it has this acidogenic effect. And what they saw is that indeed, by giving the bolus, which is the open square here, you decrease milk pH, urine pH, which is what we use to determine if that acidification happened. And then following the same pattern, once acidification happened, you see here 24 hours, you have a decrease in dry matter intake. So those animals will eat less, and as a consequence, they have decreased milk production. But in this case, like I said, they were late lactation animals. They gave the product, they decreased milk production, they decreased dry matter intake, and they didn't receive any bolus after treatment. Then dry matter intake went back up. In 3 or 4 days, they were up to normal, and milk production also went back up because there was no effect, no very long effect of this bolus leading to a long-term decrease in dry matter intake or milk yield. So knowing how it works, know that it decreased milk production, decreasing dry matter intake. They did a bigger trial than they used commercial farms, and they actually give both cow dry or control to high producing cows at dry off. So this is according to label and according to what the product is designed for. And what they found is, as we speculated before, they did find that the cows that received the bolus, which is the gray bar here, they had a decreased udder pressure in the first 3 days after dry off. And they also had, again, here is an open square for the bolus cows, they had more lying time. So they were lying down for longer, likely because this udder pressure was lower, less discomfort, so they can stay lying down for longer. So there is a welfare benefit here. And they couldn't find any differences in milk production or instance of intramammary infection, and partially they did not describe any of that because their number of animals enrolled was not sufficient to find some of those differences. So with that in mind, so what we thought that when designing the study is like, we know how it works, but what really matters is like, does it affect production? Does it affect other health? Like, does cow have fewer mastitis cases and all that? And does it make sense economically for us to use it? So that's why we did here in Minnesota in a much larger trial. So our main objectives were to describe what was the impact of the dry cow period intramammary infection. So new infections, cured rates of infections, or the prevalence of infections postpartum. What was the somatic cell count, clinical mastitis, milk production, and herd removal, and also some of the reproductive performance of those cows by receiving those bolus. We used data from one herd to check again line time and the welfare aspect to it. But most importantly, in my opinion, was we did that in a large enough sample, enough farms to determine if there was an economic impact of the product. So what we did, I'll go quickly through this, is just showing that we did a randomized control trial in 4 dairy farms here in Minnesota. And there are 4 dairy farms, but 2 of these herds, herd B and herd D, were part of the same system. So moving forward, you're going to only see 3 because those 2 are combined. And the way they're combined is just that they have pre-impaired cows in one site and second and third lactation in a different site. And when we started the project, they were just purchased by the same company. So it was kind of in the movement. So when we first contact them, there were 2 different sites, and then they become one through the project. But we did that in the summer of 2021. And here is just showing like the farms varied from 1,000 cows to almost 10,000 cows, and are a good representation of different somatic cell count in the bulk tank somatic cell count and incidence of mastitis and different breeds and crossbreds in the states and the upper Midwest. So what we did was a pretty simple setup, and it was as similar to what happens on management of the farm as possible. So at dry off, all cows received blanket dry cow therapy because we didn't want to have influence of selective dry cow therapy on this intramammary infection dynamics. The one thing that's different, we actually collected aseptic milk culture, milk samples for milk culture, because we want to determine that. And those cows received 2 bolus of bovine dry. So control cows did not receive any treatment. Treatment cows received 2 bolus. Then we monitor them going forward. During the dry period for health and herd removal events, and then postpartum, again, health, repro, and herd removal. And we also collected another aseptic milk sample to determine if they had new infections. Sorry about the dog in the background. So then here's just showing a little bit that the groups were pretty equal, and the distribution and the randomization work. So I won't bug you with a lot of this data, but just showing that the groups were pretty similar. So what we found at the end is, like I said, we were looking to production outcomes plus some health outcomes. So the production outcomes, the treatment did not affect new production. So in going forward here, we're going to have golden or yellow for control and maroon for all the treatments, for all the results for the treatment. But we can see that when we looked into the milk production over the 10 months or test days that we have, there is no difference between cows. There is a slightly higher, numerically higher milk production, but that's not biologically significant. So pretty much cows in both treatment groups, they peak around 90 days, and then they stay with pretty similar milk production throughout lactation. On the other hand, when we look into the somatic cell count during the entire lactation, we can see that after 70 days, it's pretty similar, but the cows in the control group did have higher somatic cell count in the first 2 tests, in the first 70 days after calving. And that's likely a effect of this treatment having lower under pressure, more line time, and those cows having less of the subclinical mastitis. So I understand that 20,000 cells per ml doesn't make a lot of difference, but one thing that we look into is actually when we divided the cows into cows that have more than 200,000 cells versus cows that have lower, so subclinical mastitis versus healthy cows, then we did see a pretty significant difference, a 11 or 10 percentage point difference with cows that received Bovical dry, having 10% less of those cows having subclinical mastitis in the first month of lactation. So that's something that was go along the lines of our hypothesis. And although we hypothetically expected the somatic cell count to be lower throughout lactation, we kind of didn't expect, because that's too far out from when treatment actually happened. Like I said, some of our objectives was udder health performance. So we look into dry period intramammary infection, intramammary cure, and the intramammary prevalence, or what are the prevalence of the percentage of cows that had some intramammary infection at freshening, first week post-calving. And we didn't see a lot of difference. Like we can see a slightly lower risk, about 4 percentage points here for getting a new intramammary infection. This was not statistically significant, but it's a 14% reduction on that odds. So it is biologically, it might be relevant having this 4% fewer cows, but statistically, we cannot claim that. The one thing that was interesting too, and we're pretty excited to report, is that those cows that were treated with Bovical dry did have, or this acidogenic bolus, did have lower clinical mastitis risk. So in this survival plot here, what we look at is we start at 100% here. So at calving, which is day 0, we consider that all cows did not have any clinical mastitis. And as the times go by, cows start having clinical mastitis, so those lines will drop. So again, what we see here, the yellow, which is the lower line, are the cows in the control group. And what we're showing with this is that as the times go by, more cows in the control group show and have clinical mastitis. Therefore, this line will drop faster. And the cows in the treatment group, fewer cows will have clinical mastitis, and then the curve will go down, but at a much lower pace. So what it's showing here is that the hazard, the ratio between the two is that pretty much what's saying is like the cows that are receive the treatment are 20% less likely to develop a case of clinical mastitis than the cows that did not get any treatment. I don't have results here, but like reproduction, we looked into it, but the lines are pretty much over each other, so there's no difference. So reproduction was not affected. So like I said, in one farm, we had access to health monitoring and rumination and activity monitoring systems. So we collected data from those animals to see what was there. And what we saw is the cows in the Bovical dry group, which is the red line here, the maroon line, they were actually less active than the cows in the control group. And by less active, what I mean is the way the activities measured in this system is if they're less active means that they were lying down longer. So by being less active, they were just lying down more for a longer period than the cows in the control group. And on average, what we have was those cows were 17 minutes per day, lying down for 17 minutes longer than the cows that did not receive treatment. Although this is not biologically or statistically significant, this is interesting to see that just by giving them a bolus at dry off, we can affect. So their behavior and their lying time. So it could be that there's other ways to improve even more their comfort post dry off, which is something we should definitely investigate further. But in here is just showing that it is definitely not a problem. And the one thing that I always have this discussion with some of my colleagues is they're saying like, well, they're probably lying down longer because they were potentially sick. And the way we kind of debunk this theory was, if they were sick, there's many trials and many published work showing that cows that are sick, they ruminate less and for a fewer minutes a day. And that's not what we found. Yes, we did found a difference in this rumination in the first day, which is like, if you go back a couple slides, is like when we have that drop in dry matter intake, but afterwards they go back to pretty similar and they stay similar going forward. So yes, there is an effect, immediate effect the day after, but it doesn't translate into a very long effect going forward. So it is something that has a much longer effect on the cow welfare and lying down time than it has on the rumination. So this is just showing that we can, and the bolus were likely to decrease the lying time, increasing it, but not leading to difference in rumination. And then, which is to me is the most important part, is the economic analysis. So does it pay off to use this strategy? And so we did a partial budget analysis for this. So we just looked into what are the additional costs of using the acetogenic bolus and the reduced revenue by using that, and then we decrease it from additional revenue and reduced cost. And in that analysis, we have 433 cows in the treatment group and 437 cows in the control group. And what we used was we added what's the cost of both the acetogenic bolus, and the market cost at the time was $15. And we used a $2 fee for labor for those costs. So the cost of the treatment was about $17. Then what we used, we checked into what's the cost of treatment of mastitis, because that was one of the outcomes we have, and that's something that it's easier to put a dollar sign or a price tag to it. And mastitis costs that the way we calculated, accounted for 3 days of intramammary antibiotics and 2 extra days on top of those of discarded milk. So we discarded milk for 5 days, so 48 hours after the last tube goes in, plus the price of the tube. And the direct cost, this is not accounting for the discarded milk, was about $20, which includes the $450, $460 per tube, plus $280 for treatment times 3, because it was 3 days of treatment. So $20 plus the milk we have to dump. Then we accounted for feed cost, and feeds were calculated for dry off, fresh cows, and post-fresh period, varying from about $3 per day to $9 per day, depends on the stage of lactation. And then we also included the cost of milk, the revenue for milk sold, and the revenue for cows that we removed, like cull cows, and the average milk production within the trial. We use it by month, but the average for the 10-month period we're looking was about $19, and the average per cow weight of cull cow was almost $60. And we also included some breeding costs, and again, the milk discarded with mastitis. So in total, what happens with all that's good versus minus all that's bad, what the population we had the population receiving acetogenic bolus 34,000 ahead of the group that did not receive acetogenic bolus. And that is, for the cows that were treated, that's about $78, almost $80 per cow of the group that received treatment in comparison to control. So it was feasible and economically viable in our study population. So what we look into also here was, does it change per farm? Does it change like, or is it like pre-standardized? And what we found is it does change per farm. So when we look into herd A here, we have 10,000 of profit versus 21 and 28 at 1,800. But let's go into like the per cow basis here, because that kind of controls for how many cows were enrolled in each group, and makes it easier to compare. So the profitability of the strategy was different between farms, and there are some factors that will influence that. In this farm was that Jersey Holstein crosses and has pretty good udder health and milk quality. And this farm is also the farm that has some of the lowest feed costs. So the profitability was higher. Farm D here, C here, is a farm that also has a very good udder health quality, and they don't benefit as much. On this herd B and D together here, we have a fairly good profitability, and this is the herd that has like the least. They had the higher somatic cell count, bulk somatic cell count, and the higher prevalence of clinical mastitis. So there is some effect that by decreasing that clinical mastitis, it does affect a lot on the profitability in this farm. So that's some of the theories and the behind the scenes of why the profitability varied from farm to farm. So in concluding, what we have is the administration of this acidogenic bolus at dry off. It did decrease the new intramammary infection rate on those cows. This did reduce somatic cell count and subclinical mastitis in early lactation, reduced clinical mastitis. It did not have any effect on milk production or reproduction. It did improve welfare comfort by decreasing standing time, which in turn is increasing lying time, but no impact in rumination. And it was economically viable in our study population with a variation from farm to farm, with some farm factors being important on determining if it is profitable or not. This is what I have, and I think I was not too long, but I would like to thank everyone in my lab that when I say like we are doing it, like, I mean, they were doing it, they were at the farm getting all those things done, and I was like working on the data on the background supervising, but without them, things wouldn't happen. I also thank BI for supporting, as they are the company that produced the bolus and financially support our project. And you have here all my contact information. Please get in touch if you have any questions. And with that, I'll be happy to answer any questions.
Thank you very much, Dr. Shitira. We have a fairly small group here. So if you want to just unmute and ask a question, we'll give just a few minutes for that. Doc, if you want to go ahead and stop sharing, we'll be able to kind of see the whole screen here.
Yes.
Yeah. If there's questions, just unmute and go ahead.
Yeah, and I'll write my my email address here on the chat.
Excellent.
Because sometimes people they don't want to.
Yeah, prefer to speak to you directly.
Yes, or they just don't want to ask the questions here, right? So I'm happy to answer any questions.
Well, while we're waiting, let's go with some questions we have here. As you reviewed these herds, were there specific pathogens that had better or worse luck? What kind of walk us through that? Yeah,
so we did the way we did, and the economic analysis, we didn't account for the specific pathogens they had. What we looked for was like, what's the clinical mastitis percentage? So we didn't identify what pathogens were, but what we see is like those herds that had more clinical mastitis, were the ones that benefit the most. So the working theory we have now, and we haven't proven that or actually tested that, is that just by using this at dry off, and we likely have less mastitis later on, that's how it can be more profitable, because you lose less milk that you're dumping at your treatment, less indirect milk that the cow is not producing. So that's the theory behind it.
Okay. Jen, did you have any questions that you'd collected up?
Well, Fred, I see there's one in the chat here.
Oh,
Does
okay.
this practice change the recommendation for giving a single calcium bolus after freshening?
Yeah, so no. I'm saying that assuming that I don't know exactly what's the recommendation that you're following it. Like, if you ask me the recommendation for the calcium bolus after freshening, that only applies to older cows and high producing, like definitely third and greater lactation and high producing second lactation cows. Not all cows, but it does not change anything postpartum. Like, as you look at the time frame between treatment and that is too long, and for the calcium that will be given at this bovine dry at 45, 60 days prior, it will be excreted in 3-4 days, 2-3 days after that treatment at dry off. So by the time they calve in, there's totally different calcium pool and calcium that they need to bring. That's why the recommendation for the subclinical hypocalcemia postpartum is still the regular calcium bolus, and it doesn't affect like if they receive it or not in the dry off. So that calcium is not going to be there for that long that would change anything postpartum.
I guess my question, do you see this working independently of the other management factors that you mentioned earlier, like reducing frequency of milking or reducing quality of feed or quantity of feed, or is it a combination?
No, so the way we did was independent, right? Like the farms that we work on, we're not doing any of the other things. But if your question was like, if we do that on top of the other ones, we will potentially see an even greater drop in milk production. However, like if you see the slide I have, the drops are in percentage, right? So your absolute drop will be smaller if you start with a lower milk production. So those are things that to account for, and they do in a way they work independently. If you do multiple of them, each of them will contribute some for it, and you likely decrease milk production. It's not that if you do all of it, you're gonna zero milk production in 2 days or 2 weeks, but you are getting closer to that lower milk production. The one question I'll just say, because that I got asked that many times before, is like people were asking me, could I use just the regular calcium bolus that we give, since they are pretty similar at dry off and have the same effect? And the answer is no. And it's because of that ammonium chloride that this particular bolus has, and makes it much more acidogenic than the regular boluses. And all the boluses, independent of the brand, they all have some acidogenic effect, not as much as this one, because they don't have this ammonium chloride in them. And again, there's a reason for not having it, because those fresh cows, you don't want to, they're already low in their dry matter intake, and you don't want to push them further on that.
Again, if there's questions from the audience, go ahead and unmute or type it into the chat. Luciano, we thank you for the program. A lot of good information, and you've included your email. So if folks have a question, they can contact you directly. At this point, I'm not seeing anything coming in. We will go ahead and close out the program and look forward to having you folks at next month's program or stopping by the I-29 booth at the Central Plains Dairy Expo on the 29th and 30th, or at our dairy beef program on the 28th up there at the Premier Center in Sioux Falls. Thank you for attending.